Hi, we're still on Chapter 12, the host defenses, and we've covered the overview in the first lecture, and we're now covering different parts of nonspecific defenses. In this third mini lecture, I will be talking about inflammation and fever, which are part of the second line of defense. So, starting out with the inflammatory response, this is a complex response that we see in reaction to injury. And it's very easy to identify by looking for classic signs and symptoms of inflammation. The first of which would be called rubor, which is redness, which you often see associated with inflammation. This is due to an increased circulation of blood and vasodilation in the injured tissue. We also will see calor, which is also caused by that increased flow of blood, which would be a warmth that you would feel in an area of inflammation. The swelling caused by fluid escaping into the tissue is called tumor. And then lastly, we would have dolor, which is pain that is caused by the stimulation of the nerve endings in that area of injury with regards to inflammation. You also may find loss of function of an area with inflammation. So, with the inflammatory response, we are mainly going to be talking about acute cases of inflammation, but do keep in mind that in some chronic diseases, such as cardiovascular disease, these are actually caused by chronic inflammation, low-level inflammation that is constant. With inflammation in an acute case can be either local or systemic, depending on what the infection or perhaps the trauma is. And things that will elicit inflammation, first of all, if we have trauma from an infection, that will elicit an inflammatory response. If you have tissue damage or necrosis, which is the death of some tissue, due to a physical or chemical agent, you will see inflammation. And then also sometimes with specific immune reactions. So the immune response may actually elicit inflammation to fight off an infection. So what are the chief functions of inflammation? Why do we have the inflammatory response in immunity? The first is to mobilize and attract immune components to the site of injury. So we talked a little bit about chemotaxis in the last lecture. If we mobilize and attract these immune components, that will help in the speed of helping repair an injury. Inflammation will also set into motion mechanisms to repair tissue damage, and also it will help clear away harmful substances that may be in that area of injury. And then lastly, inflammation can help destroy microbes and block them from further invading other tissue. So when we talk about inflammation, it's a very powerful defensive reaction. And it's a way for the body to maintain stability and heal itself after injury. So it also, though, can have the potential to cause tissue injury and destruction and disease. And that can happen due to microbes that actually elicit inflammation to cause tissue damage. But also we can have inflammation in the body from things like allergies or even autoimmune disorders that cause inflammation, which can cause tissue damage. This is much more rare, and it's not the actual goal of inflammation or inflammatory response, but it is something that does occur. So there are mediators in the inflammatory response, and these have a large role in how inflammation goes. These are referred to as cytokines. And there are hundreds of small active molecules that can be secreted, and these can take part in regulation, stimulation, suppression, and also help control aspects of cell development in inflammation and immunity. There's a table in your book that talks about specific cytokines and their roles that they play in immunity. I'd like you to look at that and at least have some idea of the different roles that these cytokines play. I won't, though, be testing you on specific cytokines and where you would find them or what produces them. But it is good to at least have an overview of that. So cytokines are produced by many of the immune cells including monocytes, macrophages, lymphocytes, just a lot of them. And mainly that's to help bring more aid to an infected area. The effects of cytokines can be both local or systemic, and they can be short-term or long-lasting depending on what role is needed, and they can be specific or non-specific. And once again, due to the fact that sometimes inflammatory responses can be pathologic or harmful, they can play a role as either protective or pathologic. But cytokines are a very important part of this. In an introductory class, I don't think that you need to know specific ones, but do understand their general role that they play in inflammation. So there are different stages to inflammation, and it's a predictable series of events, and it can last very short periods of time, from a few minutes up to a few hours or days. And once the initial injury has occurred, there's a chain reaction that will take place, and that will bring in all those beneficial cells and fluids to the injured area to help start healing. So in your book, there's a nice diagram of this, of inflammation. It's table 12.3, and it actually goes through the steps and the roles of different players within inflammation. So the first step would be that injury and immediate reaction. So you can show they're showing what looks to be a pin or perhaps a nail with bacteria on it that gets pushed into the skin and into tissue that causes a wound. We have mast cells that release chemical mediators, which are going to draw other immune cells to the area. We see that there's, at first, vasoconstriction. This is immediate, but it's followed very shortly in our vascular reactions with vasodilation. And what we'll see is there will be a clot that will form over the site of injury. You can see there's bacteria that have been introduced to tissue. We have neutrophils, which are those great cells that are capable of phagocytosis we talked about in the last lecture. And then we have seepage of all of these different chemicals and cells that will help in taking care of this infection. So that's part of that vascular reaction. The next step would be edema, which is swelling, and pus formation. You can see down here a scab has started to form. We have lots and lots more neutrophils, which make up that pus. And we have fibrous exudate, which is part of it that's being released now that can be cleaned up and taken away from the site of injury. And then the last part of this inflammation is going to be the resolution or scar formation. So you see that a scar may have formed over here. We have lymphocytes that are helping to repair the area, macrophages that are engulfing and going through phagocytosis of some of the cell debris and bacteria. And we have this repair done here then of that capillary that was damaged. And that is the whole kind of cycle of inflammation. For our wiki page this week, if you're one of the people who has inflammation, this is going to be your go-to table and area of the chapter to find the players and steps involved in inflammation. So after inflammation, we actually have a few different vocabulary words that I'd like to talk about that take part in inflammation. We have diapedesis, which is the migration of white blood cells out of blood vessels into damaged tissue. And then we have the chemotaxis, which I spoke of earlier, which is going to cause the migration of cells in response to that chemical stimulus. And cells will swarm the compartments of the site of infection and remain there to actually heal and get rid of the infection. So these are two really important factors that are essential in that communication and deployment during an immune reaction. So that swelling and leaky vessels play many important roles, and they have lots of benefits to an injured area. First of all, there's an influx of fluid that will dilute any toxic substances that may have been released by the foreign agent. There will be a fibrin clot that can trap the microbes and stop them from getting out of that infected area. The neutrophils will aggregate at this inflamed site, and they will help in that phagocytosis and destroy those bacterial cells. And what we'll see then is this formation of pus, which is the accumulation of many neutrophils and liquefied cellular debris and bacteria. This is getting them all in an area then that can be taken care of. And sometimes we have bacteria that are pyogenic, which are bacteria that stimulate the formation of pus. We see that with streptococci, staphylococci, gonococci, and meningococci. And this can actually sometimes cause damage. We talked about sometimes that this formation of pus also can be damaging. So it's that fine line between cleaning up an area and not causing more damage. So hopefully that explains inflammation to you. We're going to go ahead and look at fever, which is an adjunct to inflammation. And fever is described as the abnormally elevated body temperature. It's a universal symptom of infection generally. We almost always see it when we have infection, although it can be associated with certain allergies, cancers, and other organic illnesses. So normally our body is maintained at a temperature of 37 degrees Celsius by the hypothalamus. A low-grade fever would be anything between 37.7 and 38.3, while a high fever would be 40 degrees to 41.4 degrees Celsius. When we're looking at fever, we talk about why it actually occurs, and there are things called pyrogens. These are substances that reset that hypothalamic thermostat to a higher setting. And there's two different types of this. We can have an exogenous pyrogens, and these are produced by infectious agents. So sometimes it can be viruses, bacteria, protozoa, fungi, and it can also be endotoxins and other things that can be put into the blood from outside that would cause an increase of our thermostat, so a fever. We also can have endogenous pyrogens, and this is often part of the immune response. They can be given off by monocytes, neutrophils, and macrophages during phagocytosis and actually cause a fever, which will help fight that infection. So you either have that stimulus coming from outside with exogenous pyrogens or endogenous pyrogens. So what are the benefits of fever? Why would we want to have fever? And the main benefits are that they can inhibit the multiplication of temperature-sensitive microorganisms. Remember, we talked about microorganisms have a temperature that they're happiest to grow in. If we make it too high, they won't grow well. It also can impede the nutrition of bacteria by reducing the availability of iron. We have lower availability of iron with a higher temperature. And then also it will increase our metabolism and immune reactions. So it'll speed up the formation of red blood cells, of phagocytosis, and other specific immune responses with that higher temperature, which will help fight that infection. And then lastly, you might wonder, do we want to treat fever if it can have that great benefit of slowing down the growth of bacteria? So it makes it difficult to decide, and generally speaking, we don't generally treat a slight to moderate fever in a healthy person and let it run its course. This should help with an infection. However, there are side effects with fevers. There can be rapid heart rate, elevated respiratory rate, and also if you're prone to seizures, it can lower that seizure threshold. So medical experts would say that high and prolonged fevers in individuals who have cardiovascular disease, seizures, or any sort of respiratory ailments should be treated to lower that fever. Otherwise, in healthy individuals, if it's not too high of a fever, it actually will benefit and clear that infection more quickly. So that is the end of Lecture 3 of this chapter, covering inflammation and fever. And we will have one more lecture on the proteins of the antimicrobial proteins that play a role in infection.